And uh, uh, questions that I would like to ask you in regards to cervical cancer prevention.
Okay.
One of them is, just let me swap this presentation. There we go. Is in regards to communications interventions. This week, there was a very interesting article on the American Academy of Family Practitioners magazine, and there was a study, I believe, in Colorado, in regards to the use of some educational materials for patients who are going to be screened for cervical cancer, or young patients who are going to receive the HPV vaccine. And I'm not sure if you have some experience in regards to the use of fact sheets for patients, either for patients who are going to be screened for cervical cancer or for patients who are going to receive the vaccine. If I'm not mistaken, every time that a patient, a young patient, is going to receive a vaccine, any vaccine like influenza or measles or varicella, they receive the vaccine information statement. But this is more about the side effects of the vaccine, what should expect, and they have the vaccination schedule and all the information that the patient needs to complete the vaccination schedule, or in case the patient presents any side effects. However, I'm not sure if you are using any kind of fact sheets, either for patients who are going to be screened or for patients who are going to receive the vaccine.
I know we give out the ones that we have that you have to give out. Though, like, I don't know if the CDC puts those together, whoever puts those information fact sheets out, like you were describing. So anytime a patient's going to get a vaccination, we do give those. And then in addition to that, our nurses, if they're going to give an HPV vaccine, or if they're just going to talk to a patient about the HPV vaccine, then they do have. I haven't seen it in a while, but I know that they do have, for lack of a better word, a fact sheet on kind of like the benefits of getting the vaccination and what it really means. Because I know, like in our PD population, parents were hesitant to vaccinate their children because they kind of saw it as meaning that the child needed to be sexually active. So I think that the fact sheet that they give out is more meant to dispel any myths around the vaccine, um, than to necessarily, it's more as like a supplement to that fact sheet that they give
Mhm.
when they actually give the vaccine. Does that make sense?
Yes, yeah, thank you.
Yeah.
And what about for patients who are going to be screened for cervical cancer, patients who are going to receive the pap smear? Is there any fact sheet for patients in regards to cervical cancer?
I
Or
don't think so, no. But that is something that we've talked about here is like trying to get together just some sort of like, even that we could put in mailings for outreach to patients, something like very clear and concise that explains the importance of it. Um, Cervical cancer screening, I feel like, is very different than colon cancer screening and breast cancer screening. Like,
Mhm, mhm,
patients seem to understand better, like, what the consequences can be if they don't do those screenings.
mhm.
But for some reason, I feel like that same message is not heard with cervical cancer screening.
And I totally agree with you. Now, some health centers provide, I believe, both cervical cancer screening and breast cancer screenings at the same time. Is that something that you have in place, or is or not?
I wouldn't say that we like make a point to do them at the same time,
Hmm.
but we can certainly do them at the same time. So we do have a radiology staff here at the health center. So if a patient were to present and be due for both cervical and breast cancer screening, they could have their pap smear done in the visit, and then they could just go down to our radiology department for the mammogram on the same day.
Hmm. Okay, okay. And in regard, well, The other communication intervention that was mentioned in this article is the use of a website to educate patients, and I'm not sure if that is something that you may try to put in practice, or if you have it, for instance, to refer patients to websites where they can find additional information about the disease and on the vaccines and everything that is related to to prevent cervical cancer. CDC has some good information. I'm not sure if this is something that you may have in place. I understand that based on the population that you serve, probably for some of them may be difficult to have access to computers, but I'm not sure if that may be a barrier for patients.
That's a good question. So it definitely, I wouldn't say it's a barrier for most of our patients, but it is definitely a barrier for some of them,
Mhm.
um, like that not having access to a computer. Um, but even, I'm just thinking because we have a patient portal that we've really been pushing, and you have to have a computer to sign up for that. But even in cases where people don't have a computer, they usually will go sign up at a friend's house or have like one of their children or other family member like use their computer or their phone to sign up. So I do think that that could be a nice viable solution to help with cervical cancer screening. We do also print out at the end of a visit, we print out an after visit summary with education in there. And so that could be something that I think would be easy enough for a provider to add in, like, helpful websites, and then we could certainly have one for cervical cancer screening. We don't do that now.
Mhm,
Um,
mhm.
that is an interesting,
And
thing to think about.
one of the well, another communication intervention that they mentioned in this article, which I believe is very uh, important to notice, is that the education website and the resources that they have HPV related images, just to
Mm-hmm.
create some kind of awareness about the disease. You mentioned something very interesting, and it's the fact that patients are more familiar with colonoscopies and colorectal cancer screening, probably
Mm-hmm.
breast cancer screening, but they are not paying, I guess, too much attention to cervical cancer. And even though since I believe 1950s, when we had pap smear and all these screening uh, methodologies, the incidence of the disease went down. It's still a problem. It's still like 7% of, I believe, if I'm not mistaken, the latest data that I reviewed was that the mortality is about 7 cases for 100,000 uh, women in the
Oh,
United
wow.
States, which is
Wow.
yeah, which is still high. So
Yeah.
they were mentioning that another communication intervention that is very useful is motivational interviewing, and I'm not
Mm-hmm.
sure if there is any staff, either an outreach person or a health educator, providing that kind of services.
Yeah, that's a really good. I mean, that would definitely be beneficial. I think motivational interviewing can be really helpful when people aren't following what we think they ought to be following for any particular reason. Um, we do have one person, at least one person here at the health center who's trained in motivational interviewing. Um, and that is certainly something we could look at, especially for those patients where the provider's like, you know, where the provider knows that the patient just isn't going but can't figure out why they don't want to be tested.
Mhm,
Um,
mhm,
one provider here actually brought up to me that colposcopy in particular, which is usually in follow up to an abnormal pap smear, depending on HPV and all these other things, but um, patients will be reluctant to go for that colposcopy if they've had a history of trauma.
Yes.
And I wonder if that's something that we could that should actually be considered as to why patients don't go for PAPs as well.
Yes,
Um,
yes, and that's definitely a barrier and something to
yeah.
consider. You're totally right on that.
Hmm.
Yep, yep.
Yeah, I definitely think there's more to be done, especially with those patients that like just don't go and you don't know why, or they're not forthcoming with the reason why. So,
That's right. That's right. And the other, it's been, there have been some very good articles lately on cervical cancer screening, and that's the reason why I would like to have a follow-up conversation on this topic. The other thing that they were mentioning on this article is about community-based interventions, and I'm not sure if there is anything uh, that you are doing with churches or nonprofit organizations or academic organizations in the community to create awareness of cervical cancer screening and prevention.
we are not, but that's really fascinating.
You know, and
Um, we're not, but if there's, I would love to learn from another health center who is.
yes, yes,
Yeah.
that's the reason why we are trying to gather some data on well, best practices so we can share them. There
Mhm.
is the same article that I am referring to. They had a study on peer health educators and the use of male educators and female educators, for instance, for this particular topic, cervical cancer screening, right? And
Mhm.
the results are very interesting because it seems that women in general pay more attention if the person who is providing the education is a female health educator. So,
Yeah.
so, so
Yep.
it's interesting to notice that even that there is like a gender identity when you are going to discuss these kind of topics.
Oh yeah. I mean, even just like personally, I would not. I would definitely be more um, prone to listening to a woman speak on it. My OBGYN's office is, I think there's only one man that works there, one provider man that works there, and like it's just weird to be scheduled for an appointment with him because you're like, you don't know about being pregnant, or or pap smears, or
Yeah.
so yeah, I could do. I mean, just anecdotally, my N of one, I definitely agree with that.
And I believe it's across the board because
Yeah.
for men, for instance, it would be, I don't know, probably some kind of, of difficult to explain any prostate symptom to a female doctor or
Yeah.
having a digital rectal exam. And if the person
Yeah.
is going to be, if the doctor or the provider is going to be a female doctor. So I believe that
Right.
is it is the same kind of issue, I guess.
Yeah. Yeah. Oh, definitely.
But this is, well, thank you, Janet. These are the only topics that I have. I mean, I wanted to share this this article with you and see if we can find some best practices. This is something that we're going to put together, and if we have anything or more or additional information on either community-based interventions or communication interventions, I will share this with all of you.
That'd be great. Thanks so much, Jose. I really appreciate it.
No, thank you so much, and have a wonderful weekend.
Thanks. You too.
Take care.
All right. Bye
Bye.
bye.